So we did your procedure in
June. Kiana Lewis, I'm 25 years old. I was diagnosed with keratoconus at 20. I've had the cross-linking procedure done at Mass Eye and Ear.
Keratoconus is a thinning condition of the cornea. It typically presents in young patients. It can present in all ages and phases of life, but it typically presents in young patients. It's a thinning condition of the cornea where you can get progressive warpage and increased steepening and thinning. Getting diagnosed with keratoconus can pose significant challenges, and the first challenge is that patients don't innately realize that they have a problem. It can take time for them to notice that they're having vision changes, and typically by the time patients have vision changes with keratoconus, it is becoming more advanced and progressed.
So my vision began deteriorating, I'll say, at 18 when I left for college. I was having trouble seeing the board at school. It just began getting blurry for me. After being diagnosed and on the contact lenses, I did still struggle. At 20, I got my license, so I was driving at the time. I wasn't familiar with Georgia, so it was a struggle for me to get around on my own because I couldn't read the signs coming ahead, or I wasn't able to drive at night by myself because of the glare from the other cars. With keratoconus, I was concerned about going blind because that was I'll say the big devastation of having keratoconus if going untreated. And the way mine was progressing, I was thinking I was going to go blind sooner than later.
The phone calls came every day of the changes she was having in her eyes. She would complain about not being able to see the board. She would complain about the night driving or the night glare, and it would be a major problem. I mean, I was worried she has to drive on a highway every day, and the highway, it's a fast place to drive. I mean, you're doing 70, 80 miles, and I'm struggling thinking, well, my child's on the highway, and her vision isn't that great.
The goal is to stabilize it and to prevent the eye from continuing to become progressed and abnormal. And so, after cross-linking, we need to monitor for them for progression and stability, and their results from the procedure. And then from there, they can be fitted with contact lenses and reassessed. Sometimes the shape of the cornea does change after cross-linking, and so if someone is in a contact lens, they may need to be refitted.
It's important to spread the word about the treatment because knowing that there are other people out there who are just in the dark as I was when I first was diagnosed is very important. So if I can spread the word, because I know and I've been dealing with it, I'll say about 4 years before I got the treatment, I've been dealing with it on my own. So if I can spread the word and help, it is very important that I do that.
So now that cross-linking is available clinically, FDA approved, it is a very exciting time to be a cornea specialist and be able to have a treatment that is effective for keratoconus.
As a parent, it's my life's work to do is to make sure my child is totally fine. Trying to find a specialist that knew of what we were trying to explain was tough. It was actually pretty tough.
We've come a long way. Even 10, 15 years ago, we were just telling patients we'll see you in a year, and hopefully things will be stable, and giving them no treatment option other than contact lenses. So we've definitely come a long way. I think we're still in the infancy of cross-linking. I think there's going to be future applications to cross-linking. Maybe we should be screening patients much earlier and finding this condition. Now that we have a treatment that works and is effective at stopping progression.
So far, so good. I'm looking forward to continue traveling and living my everyday life with my vision.